Good afternoon, everyone. My name is Sally Guy. I am the Director of Policy and Strategy at the Canadian Association of Social Workers, and I have the honor of welcoming you to the third and final presentation in this series, which has explored the results of the Canadian Centre on Substance Abuse's study, which was titled Youth Perceptions on Cannabis. So today's specific webinar, which is titled Effective Youth Engagement to Enhance Prevention, Treatment, and Recovery. Part 3 is called Framing the Conversation, is a collaboration between CCSA and CSW, of course in celebration of National Social Work Month. Today we've got social workers tuning in from all across Canada, and we're very fortunate to have Anna McKiernan, who is a Research and Policy Analyst at the Canadian Centre on Substance Abuse, and also Daniel Dacombe, who is a Rehabilitation Counsellor with the Addictions Foundation of Manitoba. They're both presenting for us today. So some quick housekeeping items before they get started. The speakers are going to take about 45 to 50 minutes, and then we'll do a 15 to 10-minute question and answer period that I will be moderating. As a quick note on privacy, only the presentation team can actually see your name and the question you ask, so do feel free to type those questions in throughout the presentation. Also, as a reminder, the recording and the PowerPoint of this presentation will be up on CSW's website afterwards for your access. So with those things said, it is my great pleasure to welcome our first speaker, Anna.
Thank you, Sally. I appreciate the introduction. So as Sally was mentioning, I'm a researcher from the Canadian Centre on Substance Abuse, and I work very closely with Katie Fleming, who was the knowledge broker that presented on the previous two webinars. And I was actually the researcher that conducted the study for the youth perceptions. So today I'm just going to be talking about what exactly the research tells us in terms of how best to approach youth and speak to youth about substance use. So I'm not going to go over too many of the details from our study because I know that most of that was already covered, but I thought I would just kind of refresh everyone with what exactly our youth suggested to us as effective ways of preventing or managing substance use among their age group. So something that youth wanted was they wanted the prevention messaging to be delivered by someone with experience. So they thought that these types of messages would resonate most coming from someone who has actually experienced substance use, has experienced potential harms, as opposed to, the traditional authoritarian teacher or police officer, which many youth were under the impression didn't have experience with these things, which, as we know, isn't necessarily true, but that's how they see things. They also reported that they would like some sort of guidelines for using cannabis. So specifically, they would ask me questions such as, how can I use cannabis without hurting my brain or causing damage to my lungs? So they're aware of the harms and they want kind of those ways of using without putting themselves at risk. They also spoke a lot about how prevention approaches need to target different audiences. So in their opinion, they would kind of delineate between, the good kids and the bad kids, and those kids that were maybe struggling more or from different backgrounds were less likely to to really get much from the traditional, presentations in auditoriums or teachers standing up at the room and talking because they often didn't go to class, or, they just kind of had to be targeted in a different way than those students who maybe had less of those issues. So they said that that would be an important thing to delineate between. They also wanted more information. So they wanted to understand how exactly drugs affect their body. So they understood it causes brain or problems with the developing brain, but they wanted to specifically understand how that process worked. And they also want to understand a bit better, the difference between mental health issues and addiction. They want to understand the long-term effects. So if I'm using now, what exactly am I exposing myself to in the future? And they would also like to see some strategies to quit. So based on these results, we kind of pulled together some recommendations for prevention that is based in the literature. And specifically, this is not a difficult one, but we know we want to increase the availability of education about the risks of cannabis use. So specifically, they wanted more information on how cannabis affected driving. So they really understood the messaging behind alcohol-impaired driving, but they didn't really know a lot about how cannabis affects a driver and their body and their brain. So they wanted more information on things like this. They wanted both sides of the story. So they They know that there's a lot of different research out there right now regarding cannabis harms, and they know some of it is positive and some of it's negative. So we know that there are some medical uses being explored. So they wanted all this information presented. They didn't want to just hear what the bad side of things were. They want to also know what the good things are as well. They wanted to be involved in the development of these types of initiatives. So we know from the research that programs that are actually designed by the target audience are going to be more effective to reach that audience, and also programs that are delivered by peers to peers, so youth delivering these programs to their peers is also effective as well. And a lot of them mentioned that the prevention efforts that they had been exposed to were provided to them a bit too early in the game, or sorry, a bit too late in the game. And they actually suggested that it'd be better to have these messages provided much earlier. I think a lot of them referenced maybe grade 5 or grade 6 as opposed to maybe grade 9 or 10. And they wanted to see consistent follow-up with these initiatives. So not just having this kind of one-off presentation that they don't really hear about again in the future, but instead continually reinforcing these messaging down the road. So we know in the research that this is correct, this is a good approach, and that starting early before substance use is key, and ensuring that there's that consistency where the messaging is being followed up on. So some implications of these results specifically for practice. So we suggest that, those in positions of dealing with youth and providing youth services, that they actually provide tools to manage stress or mental health. So one of the main reasons that youth reported using cannabis was because they were stressed out and they were trying to escape, or they were trying to medicate some sort of depression or anxiety, or helping them sleep. So there's a number of different issues that they were self-prescribing for. So that kind of signaled to us that we need more resources available to help youth manage these types of issues that are different than using substances. We also want to make sure that we're teaching them those critical analysis skills, which we'll get into a bit further, but to help navigate all the information available. So anyone who signed on to, Facebook or Reddit or anything of that nature, there's hundreds of different pieces of information about cannabis available, and it's challenging for youth to know how to wade through all these different sources and understand what's evidence and what's not. So I think that's going to be a really important thing coming down the pipe in terms of legalization, to make sure that our youth have these skills for navigating the internet and sources of information. So we want to also increase the availability of this evidence to parents and educators, so those working directly with youth, and ensure that those pathways are provided on the healthcare side of things. So we know that doctors or healthcare practitioners can identify if there's an issue with substances, and they know where to send youth if this is a problem. So I just have some kind of tips and tricks that I pulled together from some of these resources that we really come to rely on here at CCSA. They're kind of for parents or just any kind of trusted adults who are working directly with youth and would have the opportunity to speak to them about substance use. So this information has been pulled from the resources you'll see here on this slide. So the Good to Know Colorado. So this is a prevention campaign that was rolled out in Colorado when they legalized cannabis, that has some really great research behind it. Skylark Youth Services provides Sessions, which is a drug education program to support youth. We also have iMinds, which builds drug literacy, Helping Schools, which is designed specifically for addressing substance use in students from teachers, and Cycles, which similarly helps to educate and explore decisions related to drug use, as well as Here to Help, which is specifically for parents' guide. So there's a lot of different resources available, especially Canadian resources, that can help guide some of these conversations, and we can just go over some of the few points here. So talking to youth. So like I mentioned, you're going to want to start the conversation early. You want to be targeting their thoughts and their perceptions and their understanding of drugs before they are actually given an opportunity to use drugs. So this can start much earlier than you would think. It doesn't have to be just, quote unquote, the talk or the drug talk. It doesn't have to be like a serious sit down. But it could just be the fact that you're not hiding substances from youth. So a researcher out at U Victoria, Mr. Dan Reese, he gave kind of an interesting example of this. So he mentioned that, there was a point when he was walking through the neighborhood and he was with his 4 or 5-year-old, and they smelled cannabis. They could smell someone smoking pot, and, he said, "Daddy, it smells like skunk." And instead of him saying, yeah, it's just a skunk and trying to hide it from him, he said, no, actually, that's someone who's smoking marijuana. And he used that as an opportunity to talk to them about what that means without making it kind of a very serious and all-encompassing conversation. So you can find ways of infusing this topic into just general conversation day to day, because we know drugs come up as in many aspects of life. It's going to be on TV. It's going to be in social events with adults drinking. These can all be used as opportunities to talk to youth about substances. And this kind of gives them a chance to critically assess these real-world situations and begin to develop their own personal views. So we really want to support a constructivist approach. So this just means having an honest and open conversation with youth where you're showing curiosity in how they understand substances. You're asking them what they think and what their opinions are, which we saw in our focus groups was something that the youth really valued. So you're participating in this conversation with them. You're not controlling the conversation. It's perfectly acceptable to admit that you don't know all the answers and that sometimes you can be wrong too. I think this kind of puts youth at ease a bit and gives them a chance to explore and develop their own ideas without feeling like they're being told what to do. And last point there, you can role play with them. You can start to give them kind of examples of real life situations where they might be offered drugs and they'll have to learn to say no. So that we can kind of early on help them make sense of conflicting messages and help them practice these decision-making skills with challenging situations. Next slide. So further to this, we want to make sure that youth feel heard. And this, having these open conversations can be a little bit scary. We don't always know what's going to come out of their mouth, and, things can get awkward. And some youth might kind of go for that shock value to kind of throw something at you to see how you're going to respond. And that's okay, because it's a discussion and we want them to know that ideas are simply ideas and all are welcome. And from there, you can kind of validate their inquiries and guide them to a source of information to help maybe respond to some of these questions they have or thoughts that they have. So it's important to keep in mind all the different influences of youth. So we know that, their family, their friends, the sports that they play in, their school, these are all things that are really important to them. And depending on where they are in their life stage, these priorities can actually, greatly influence the decisions that they make regarding substance use. So we want them to understand that there are long-term unintended consequences of substance use and that these can affect their long-term goals. So in order to do this, you don't want to, scare them or make them feel uncomfortable, but you can kind of focus on what they have to gain by maybe making certain choices regarding substances. So instead of telling them, you're going to fail out of school if you're smoking pot, you can just say, keeping in mind these healthy attitudes, you may be better able to focus on getting a scholarship or kind of more of the positive side of things. And having them keep their goals in mind when they make these decisions will help them down the road. So finally, especially from a parental point of view, you really want to be supportive. You acknowledge that this is ultimately their behavior and it's their decision what they want to do, but that there are still some ground rules that exist. So it's okay to be clear about what your rules are, and you want to be consistent and ensure that they understand that these are in fact consequences, but at the end of the day, it's their decision to make, how they want to behave. Your influence matters. So as much as they might not behave as though your influence matters, your actions, your words, your opinions, youth are noting these and they're going to factor them into their behavior. So you want to make sure you're reinforcing positive behavior through your own behavior as well. So for example, if you were to tell a youth, you shouldn't be smoking drugs or something of that nature, and then you turn around and there's someone in your group of friends that smokes pot and this doesn't bother you, they're going to notice something like this and they're going to see that that's an inconsistent message, and that's going to affect how they understand things. There's going to be situations that maybe the youth will be silent, or maybe they're not going to be in the mood for sharing when you're discussing these issues with them, and that's okay as well. So really what you're showing them is that you're there to support them. So if they want to sit in silence or if they want to vent to you about something unrelated to the topic, just showing that your first priority is being there for them just is going to build that relationship where they're going to feel comfortable coming back to you to talk to you about these things. So as I mentioned, the critical thinking and refusal skills are important skills to kind of hone with youth. And they need to understand, why exactly would they choose to use substances? Is it to do with, just a curiosity or something that their friends are doing? And it's okay to have your own rationale and your own reasoning for doing this. They also should be aware, and yourself as people speaking with youth, that there's other interactions that might be influencing these decisions. So, for example, as we all know, peers are very influential. So someone might be using substances not because they want to or because they're super interested in them, but maybe they just want to fit in with a group. So that's going to really kind of tailor the discussion you're going to have with them, since the discussion might be towards, developing positive relationships with other peers as opposed to kind of the anti-drug discussion. And you want to make sure that you're keeping this conversation going. So like the youth said in our report, to continually discuss this, to have it as a top-of-mind conversation instead of just a one-off. And as youth age, their opinions may change. So you want to make sure they're constantly reflecting on how they understand these concepts. And just remain connected with them. Show that you are interested in other aspects of their life, not simply telling them, what to do or how to behave. So specifically what not to do. So we know that the research shows that scare tactics don't work. Youth kind of see this messaging as very preachy, and they think it's over-exaggerated and biased. And because of this, they tend to just kind of discredit any of the information provided in that way. So it's not really an effective way to reach them. You also don't want to necessarily tell them what to do as opposed to what not to do. So you're not supposed to say don't do drugs, but you're also not necessarily supposed to say, you should make this healthy choice or you should do that healthy choice. It still comes across as a bit of a judgmental tone. Instead, you want to approach it as, how do you think you should approach the situation, or what do you feel comfortable doing, and get them to think about their behavior as opposed to telling them what to do. You don't want to give off that there's like a right or wrong choice that they must choose, because that's kind of a form of shaming, so disintegrative shaming. It's kind of making them feel they have to choose abstinence or they're doing something wrong. So finally, if they do kind of want to confide in you that they are using substances, you have, to do your best to remain judgment-free. And this kind of increases their chance of continuing to share this type of information with you and keep you in the loop, and they'll feel comfortable coming to you without necessarily feeling like you don't support their decisions or what they're doing. So just quickly, the last slide. So it's just important to keep in mind there's a continuum in terms of the reasoning for substance use. So not all use is necessarily concerning or harmful. There can be an experimentation phase, which is simply just related to curiosity or being able to fit in with friends, where that more serious type of use is when youth are using to cope or to escape reality, and that's when an addiction could actually develop. You want to make sure that youth understand this difference and that they may recognize if themselves or their friends are moving towards that harmful use. And you can use this to kind of frame your discussion and how you want to approach things with them as well. So that was it from me.
So thank you so much, Anna. For those of you that tapped in after the introductions, once again, that was Anna McKiernan, and she's a Research and Policy Analyst for the Canadian Centre on Substance Abuse. And so next up, we're going to have Daniel Dacombe, who, again, is a Rehabilitation Counsellor with the Addictions Foundation of Manitoba. Take it away, Daniel.
Thank you for the introduction, Sally. And thank you for everybody who tuned in. I have a question for the listeners, actually, and I'm hoping that they will respond in the Q&A section. And the question that I have for them before I kick off is this: what kind of pressure do you feel in your workplace to change the behavior of the youth that you work with? And that's going to be important as we go through, but I'm really curious to see what people have to say about this. What I'm going to be talking to you guys about today is a series of brief intervention skills. The Brief Intervention Skills Project was started at AFM back in 2008 and received federal funding for a team to begin from 2011 to 2013 to do research and development of a series of presentations. These presentations were given to social workers, doctors, nurses, and care providers all across the province. And the goal was to reach service providers who were going to be interacting with youth at a level that wasn't addictions counseling. So what I'm going to do today is I'm going to be taking this presentation, which I should tell you is a 2 to 3 day seminar, and I'm going to be condensing that into about 30 minutes for you. The goals I have for us today are to increase the ability of social service providers who are tuning in to use substance use intervention, to increase early identification and intervention, and to decrease the number of youth accessing long-term treatment. To get into a definition of brief intervention, it's a very brief motivational conversation. It can be described as an interaction that helps promote positive change in the form of thought or talk or actions in individuals. It also provides screening tools and assessment knowledge to appropriately choose what would be the most effective intervention option for the person with substance use issues in an open and supportive way. Brief intervention is a process that encourages appropriate intervention options for working with youth. It can be as brief as a 3 to 5 minute conversation around the relationship a young person has with a substance, or as informal as spending an afternoon with a young person doing a non-related activity while having an honest discussion. So how brief is brief? A brief contact can be anything from a single contact lasting less than 10 minutes, a single meeting 10 minutes to an hour, one or more brief in-person contacts, plus you can provide materials, an in-person phone or mailed feedback based on an assessment conversation, or multiple interactions of limited length and number. So many of you who are social workers, I know, have limited access to your young people. You may only see them for a couple of hours a month here and there, and that can limit what you feel able to do with them. And so these brief intervention strategies are for you specifically, so you can have some kind of impact on a substance-using youth. This is a very helpful graph that we've developed to sort of look at the amounts of use and what kind of use they're having. So as you can see, the vertical axis is the number of adolescents and the horizontal is the severity of drug use. So the largest number of youth are going to fall in the no use to mild use category. And at the bottom in the blue bubbles, we see the appropriate response. So youth who are not using or are only using very mildly, education and prevention is the appropriate response. For those in the mild to moderate, getting close to substantial use, we use brief intervention skills, and that's what we're going over today. And for the substantial to severe use, we use specialized treatment. Most young people will not move along this continuum. Most stay relatively towards the none to mild to moderate area of use. And when I'm working with social workers and working with young people and their families, often the first response to realizing a young person is using drugs is, we need to get them into rehab. And rehab is not the best or first option for most young people who use. In fact, 90% of the Addictions Foundation of Manitoba services are not residential. Rehabilitation or live-in treatment would be appropriate for somebody in the substantial to severe category. But for most of the people you'll be seeing, the brief intervention skills we're going over today will be very helpful. Research around brief intervention skills has shown that interventions and supports are more effective when they're provided by people who have relationships with youth, and you, as social workers, will be fitting into that category. So since it has been proven effective to use brief intervention, it is fully supported in Health Canada's best practice for early intervention, outreach, and community linkages. Brief intervention strategies have been found to be diversely and holistically beneficial for intervening early with youth with problematic substance use. So the elements of brief intervention can come down to what we call the frames approach. I'm going to be going through these fairly quickly as we have a lot of content to cover today. The first part of frames approach is feedback. It involves conveying concern to youth about their current problem substance use without using professional jargon. We need to personalize these conversations with young people and not just resort back to our professional language. Second is responsibility. We need to communicate to clients that their change is their responsibility and they have responsibility for their own use. Advice is the next, and this involves providing succinct recommendations that highlight the potential benefits of not continuing with current use patterns. We often combine these with expressions of concern or caring. Providing next a menu of options is beneficial because it highlights what we would like the youth to consider as a healthy outcome or practice, but also encouraging them to think about the various options they have. And if we can encourage them to think about the options they have in between meetings. As discussed in the previous webinar, we need to always have empathy and express that empathy in our overall manner as service providers, and help youth to resolve their issues through self-efficacy, increasing their optimism for pursuing change through exploring their own strengths or the resources available to them, not just through us pushing at them. Now, change is a process, and when we're talking about change, we need to talk about how people have ambivalence. Even when there's harm, youth are often ambivalent about changing their cannabis use or other drug use. And in order to express their ambivalence, they need to feel comfortable with us to do so. Their ambivalence is going to basically look like this little pie chart here. They have some desire to stay the same and some desire to change. And the sizes of those can change from day to day. I often meet with youth who one day will say, I have no desire to change at all. The next day, well, okay, I have a little bit of a desire to change. The day after, it's back to the first position. And that's okay. It's a part of being a human being. We have ambivalence. Ambivalence is normal. And the only kind of change that's going to occur with this ambivalence is when we can help a person to get unstuck, when we help a person realize that they're responsible for their change and we are not going to be pushing them to change. A quote from a book by Prochaska and DeClement, who are two people who talk a lot about change. They've designed motivational interviewing. They said that, in fact, it can be argued that all change is self-change, and that therapy is simply professionally coached self-change. There are 4 steps to brief intervention that we're going to be going over, and as we go over these, I'd encourage you to look back on them later and design your treatment or design your conversations around your young people with these steps in mind. The first step is to raise the subject. We need to establish rapport with young people like we talked about last time, and for when we are asking permission to raise the subject, we want to make sure that we're respecting the young person's right to say no. For truly brief intervention, we want to use interventions that are simple and conversational, not overly clinical, and having that conversation with a young person and doing the screening is going to be essential for us communicating our concerns properly. At AFM, we often use the C4 approach, which was developed in 1999 by Kevin J. Drab. The first C is concern. We ask them, have you felt any concern about your drinking or drug use? The next is criticism. Has anyone criticized you for your drinking or drug use? The next is cutback. Have you tried to cut back on the amounts or how often you use? And the last is coping. Do you ever use to cope with problems? These are 4 simple, conversational, informal questions that can provide a lot of context for somebody's use. If used well, they can also provide information about the developments of tolerance and dependence, which are a part of the official DSM criteria of harmful and dependent cannabis use. One useful tool that AFM has developed is called the levels of involvement, and this is a way of looking at the scale of someone's use. And I provided a bit more information to Sally about this, which I hope will be available online after the presentation. But the way the levels of involvement works is that it's a scale that we use to talk about a young person's use with them, talk about their relationship with it. Now, the relationship concept is common in addictions work, but this levels of involvement is mostly a Manitoba AFM term. People move through the scale from non-use to irregular use, to using on a regular basis, to using on a regular basis with some harms being involved, and finally to dependent use, where they may be using with some harms involved and also having difficulty quitting or cutting back, spending more time thinking about their substance, experiencing more cravings, having experiences where they can't have fun without the drug, and also having more tolerance. We use this with every young person that we talk to. This is a standard part of our assessment, and hopefully the information that we provided will be online. You can also look for it on AFM's website. This next part is not going to be news to anybody. This is the stages of change. As social workers, I'm sure you've seen this multiple times. It was developed by Prochaska and DeClement in 1986, and people tend to move through a certain series of stages as they are working towards changing a behavior. And many of us go through this ourselves when we hit New Year's and we've got to make those New Year's resolutions, and we have different stages of change for how we go about giving up chocolate for the year or whatever it is we're doing. They move from contemplation before they're ready to think about changing behavior, through contemplation, through preparation, action, and finally maintenance. This is probably not going to be news to any of you, so we'll skip over it in detail. But if you need a refresher, I'd encourage you to follow up with more motivational interviewing support. The second step is to provide feedback. We need to express the concern we have with empathy about their behavior. We need to definitely emphasize autonomy and self-efficacy. We need to be non-judgmental and direct and objective. It's very difficult to do this sometimes when we don't have a relationship with youth. So like we said before, establishing rapport is very key. Now, I often hear when I'm talking to service providers, how do I start providing feedback? How do I start that conversation with a young person? Well, first of all, we need to ask permission. Not only does asking permission show respect for the young person's autonomy, it also serves to increase their engagement. It requires the person to verbally agree to engage in the task. And if they refuse and you respect that decision, this will build alliance. We need to express the concerns with empathy. We need to understand that their priorities and ours might be different, but we may have some shared goals, and we can highlight those goals. We know that, for example, we might know that one person wants to get their child back and their child to thrive, and that may be a goal that we have for their child as well. And so we want to highlight that shared goal and talk about how we can reach it together. We need to acknowledge and explore the natural consequences. And many of these young people will acknowledge, yeah, since I started using cannabis more, it's been harder to focus in school. It's been harder to achieve my goals. It's been harder to maintain my relationships. And so instead of trying to look for things that aren't there, we need to highlight the natural consequences that they've already been experiencing. We also can provide a menu of information, a menu of options for them as far as where they want to go next. Doing this respects their autonomy for choice. We do want to caution that it's generally recommended to limit the amount of information and prioritize the most important messages first, because studies tend to suggest that we don't remember more than 3 take-home messages from a visit with a social worker or a care provider. So you want to make sure that it's going to be not overwhelming for them. Finally, we can talk about what others have done in their situation. And I often use that as a helpful tool to discuss with a young person who's having some ambivalence about what they want to do with their cannabis use, and discuss what I've seen be successful for other people. There are a few traps that we try to avoid, and if you have teenagers, then you are probably well acquainted with many of these. One of the traps is getting into question and answer. It's basically just limiting yourself to you asking yes or no questions and them responding in single syllables. The next is confrontation and denial. If we're trying to force an understanding of a substance's harms, especially ones that are socially acceptable like cannabis, young people will often get their hackles up. We don't want to fall into the expert trap, coming across like we are the expert and they have to listen to us and we think we're better than them. And I mentioned last time in the previous webinar that we can allow young people to educate us about their experiences, and that's a tremendously powerful tool. We don't want to label them as an addict or as something negative. We don't want to prematurely focus on their drug use. It might be the most important issue for us in the meeting, but for them the most important issue is this service provider going to connect with me? Are they going to take care of me? Are they going to have my best interests at heart? And we also don't want to blame them. Like Anna said, we don't want people to feel shamed for their use. We don't need to necessarily force people to try to plan if they're not in the right stage of change, because that might make them resistant. You've got to remember that brief intervention is not a one-time event. We can be directional, but we don't want to rush the process or the person. The next is enhancing motivation. We can assess somebody's readiness using scaling tools like the stages of change or the levels of involvement, and then we can enhance their motivation for change using motivational interviewing approaches and techniques. And motivational interviewing is probably not news to any of you. It's an active, client-centered way of being with people. It increases a client's natural desire to change. Many of you have probably taken MI training. All AFM staff have gone through MI and coaching. This is not an MI workshop, so I can't spend as much time on it as I would like. But the key to enhancing motivation is identifying what it is that moves this person forward, to listen for and understand what they value and how their current use of substances might not align with what they value. We need to also remind ourselves that MI is a way of being with people, not simply a process or a set of techniques. MI can be done in as few as a couple minutes or as a part of a long-term intervention and treatment. So for our purposes, we're just going to touch on a few concepts and techniques that MI uses. If you want more information on this, we do encourage you to follow up and get some more training. You may be familiar with the OARS skills or the OARS approach, and I use this on a daily basis with young people. The first goal of OARS is to initiate change talk or statements of self-motivation, and we do this in 4 ways. Open-ended questions, questions that aren't just yes or no answers. For example, so what makes you feel that it might be time for a change? Or a more youth-friendly question might be, what is it that other people are concerned about for you? What do they hassle you about? And if they just give us blank responses, we can say, well, do you feel upset by this, fine with it, or something else? Give them a menu of options. We want to ask questions in a way that encourages them to do most of the talking. We want to give affirmations. They must be genuine and congruent affirmations. You can't tell someone that they have skills or talents that they don't have, but we can acknowledge their efforts and strength. We can give statements of appreciation and understanding. We can recognize the successes that they have, even if the successes aren't the ones that we would like them to have. We do reflective listening, which is not going to be a new skill for any of you, acknowledging their thoughts and feelings. We also want to do summaries, which is what we like to call collecting bouquets of change talk. It's a summary, connecting the dots. For youth, this is especially important because their abstract thinking ability is not as developed as ours is. And so we can be an external brain for some of them in this way. The 4th step is to negotiate and advise. Like we said before, we can provide a menu of options and advice. This is supposed to be interactive. We set goals, and the plans will belong to the client. And then we also need to work at following up. A few ways that I've found successful to negotiate and advise on goals and plans is to test the waters. We ask clients, what do you think you'll do? What do you think you'll do after that? Where do you think you're going to go from here? What do you want your goals to be? We really need to recognize their readiness, and using the stages of change can be a very useful way to do this. And we need to return to ambivalence. If they come back over and again to saying, you know what, I'm just not ready to change, we can acknowledge that and we can respect that. And the more we acknowledge and respect that, the better off our relationship with them is going to be. Finally, at the end of negotiation and advise, we want to talk about following up. And follow-up is something that I'm sure many of you spend much of your day doing because you're interacting with young people, following up on cases and things like that. The change process and the need for support doesn't end with the referral for the person or for their family or their community supports. Too often, both the client and the supports tend to think that it does, that once that you're involved, everything's going to change. But it's essential to continue the care. Getting into an alcohol or drug problem and lifestyle usually takes years for young people, and a lot of helpful people will be involved in their process of getting out, which could also take years. Developing a new life free of the control of alcohol and other drugs can take a long time. Brief intervention as a strategy can serve as a foundation for this ongoing involvement. And whether the referral is to you or whether you pass them on to an additional program, it can be a great way to identify if further intervention is needed. In the case of a referral to an alcohol drug-specific program, such as the Addictions Foundation of Manitoba, there are no magic treatment people or programs, even though some can be very good. Generally, what a young person can expect from a referral is community or residential treatment and some help along the change process path. Treatment, if it's residential, can offer some clean time, some time away from their use, and some understanding of why they have arrived at their place of use. But we can also do that with community programs like AFM or like the one that I work with, which is the school-based program. However, all of these can be sabotaged by negative brief interactions. And I'm sure we've all had those with young people where we feel like an interaction has fallen flat. And so what this is working towards is helping us find better ways of briefly interacting and better ways of using motivational interviewing and other strategies to help them along the change process. Change takes time and effort. The home, community, and family support is critical. We'd often talk about the wraparound method of interacting with young people and interacting with their communities and supports. The wraparound method is evidence-based, just like brief intervention, and is one that is being more supported by research as it comes up. Our hope that brief intervention as a strategy for you to take home is going to be useful. It's going to be helpful for the young people. It's going to help them to feel like you understand them and you want them to get better and you want their decisions and their choices to matter in that process. Finally, for many of you, you probably feel, as I have felt in the past, that a young person's change is all on your shoulders. And I want to provide you with some encouragement that it's not. We can feel that way when we're speaking to parents, when we're speaking to our supervisors, when we're speaking to other collaterals who are involved and who expect us as a service provider to have the magic bullet, and we don't have it sometimes. What I would like to hope is that brief intervention might help inform, invite, and involve more of you into the process of working with addictions, and also help to recognize the young person's responsibility for their own change process. And looks like we managed to get through all of my information, so I guess, Sally, that's it, and we're ready to do some questions.
Well, thank you so much, Daniel. And the question that you actually posed at the beginning of the presentation, which I'm going to try to paraphrase, tell me if I'm wrong, which was, what kind of pressure do you feel to change the behavior of the youth that you are working with? Did I get that?
Yes, that's right.
And so that, I think, really resonated with our audience. And by the way, we had 100% audience retention throughout this. That always kind of amazes me. So everyone that started with us is still here.
Oh, great.
So a few people tuned in and said similar things like, the pressure I feel is that parents just want their kids to be fixed. And fixed is in quotations, like, fix my kid. And then a few other people said things around, the pressure I feel is coming from policy, which for my area of work is based on the abstinence model. And also that subsequent returns to residential treatment are limited and unwelcomed. With that kind of thing. And then we have other perspectives, people tuning in and saying, I work alongside youth crisis clinicians, and I'm unaware of any workplace pressures that relate to abstinence conversations. So sort of both perspectives there. Do you care to comment on that?
Sure, yeah, and I've seen some of these responses coming in as well. And I think that it really depends on the agency. It depends on the area that you're working in. It depends on the public education about addictions and these issues. Working in AFM, we have a great staff. We have a great support network in the agency, and so there's really very little pressure. We have a very good understanding of what change is about. And when I say that everybody at AFM has taken motivational interviewing, I mean everybody. They made it standard for all staff. So the cooking staff at the treatment facilities, the janitors, the CEO, everybody has taken the motivational interviewing training. So we all have a good understanding of what it's all about. Because realistically, anybody who's working in an AFM facility could bump into a client at some point and need to know how to navigate that situation. But depending on the agency, depending on what supports are available for that agency, and also someone mentioned the abstinence model, you're going to experience different things from different service providers and from different collaterals. So my hope is that as more people start moving towards a harm reduction model, more people start having better education and better public education about these issues, we're going to see less of that pressure. And I can certainly I can certainly understand how people feel. Someone mentioned the parents, and we get a lot of pressure from parents saying, we need to fix my kid. You need to make them stop using, and parents sometimes are very resistant to harm reduction messages, despite the fact that they're evidence-based and they have a better outcome and are more likely to result in less harms to their child. And the response that we sometimes have given at AFM when someone says to us, well, you're doing this harm reduction thing, but you wouldn't do that if it was your child. And I've had that question or that statement thrown at me, and I said, you're absolutely right. I wouldn't be able to do it if it was my child, which is why I would be a very poor counselor for my child. And I would want them to get the best kind of support from a professional who wasn't me and who could think objectively and do what was best. So I understand that there's going to be a wide variety of experience. And for those people who aren't experiencing the pressure, that's fantastic. And I'm glad that your workplaces are so supportive. For those of you who are, I really hope that you're able to either come back to your workplaces with a new perspective or even help change the perspective in your workplace, because it's not helpful to you as a clinician, as a service provider. It causes pressure, it causes burnout, and it's not even really that accurate, because the young people are the only ones who can affect change in their lives. If you want someone to stop using and you want to force it, you have to arrest them. And that's not really the best way of getting treatment.
Yeah, no, great answers, I think. I'm going to ask one more of you, and then I'm going to switch over to some for Anna, just so that we go back and forth a bit. This one is a little bit more specific, but I think also applicable in our context federally. How should we best approach the topic of cannabis in BC, where it's fairly ubiquitous, even while illegal, and will use grow in adults once legalization occurs? So I think the bulk of the question really is, when parents are using marijuana as well, is it even reasonable to have these types of conversations?
Mm-hmm. Well, to speak to that, I would say that the drug that I speak about the most to parents, young people, school groups, and everything is alcohol. Like by a large amount, that's the drug that they're most likely to experience harms from. And it's a legal drug. And you can look at the World Health Organization's numbers that came out a couple years ago, where they looked at early deaths, and they said that the deaths caused by alcohol through both overdose and accidents and things like that was more than double the amount of deaths caused by all illegal drugs combined. So clearly, even though alcohol is a legal drug, we've got to have lots of conversations about it. We've got to have lots of conversations about safe alcohol use, responsible alcohol use. No one in the world thinks it's a good idea to drink while you're driving, and we all know this because of good and responsible prevention efforts. So whether marijuana is legal or not, we can still approach it the same way we do with alcohol. And when I'm talking to young people, we identify legal things that aren't good for you. Everybody knows that cigarettes aren't good for you, but they're legal. Everybody knows that bungee jumping can have harms, or jumping out of a plane can have harms, but those things are legal. And so we talk about risks, we talk about rewards, and we try to focus purely on the science. And when parents are using, that's a difficult thing. It doesn't just happen in BC. I've had lots of clients whose parents were heavy marijuana users, and it's pretty common for those people to also have some harms in their lives that are impacting their children. So we can identify, well, how has your parents' use negatively affected your life? And what are some things that you wish you could change about your parents or your parents' use of cannabis? And look into the context that each youth is coming from. Now, I do agree that there's going to be a few different kinds of conversations happening when marijuana does become legalized, but the messaging is going to change, I think, very little, because just because something is legal doesn't mean it's safe. Just because something is natural doesn't mean that it's safe. So I think that the messaging from AFM's perspective is not going to change a great deal. We're hoping that we can emphasize the public health approach to it and go from there. I understand that BC is a very different context, and I have a feeling that the use rates are a little higher out there too. So.
No, I think that's a good answer in the sense that just bringing it back to issues of alcohol and to the fact that, BC is specific, but I think that we're all experiencing this across Canada as well. Next question is for Anna, but it is related to the topic of parents and parenting. So based on the focus groups that you conducted with youth, were they reporting speaking with their parents about substances or about their substance use?
So we definitely found it interesting to hear about what types of conversations the youth were having in the household. That was something we often asked, and we were surprised to find that there really wasn't a lot of conversation, that for the most part they were well aware of kind of the attitudes that their parents held towards substance use. They would mention like, oh yeah, I'd be in so much trouble if I did that, and oh, I don't think they'd be supportive of that, or those types of things. But some of them, very, very few of them, did have kind of those open and honest conversations, and it appeared as though, and it was a qualitative sample, so we can't always draw conclusions, but they seem to really value those conversations. So I think that it's something that youth would appreciate, is having an open and honest environment within the household where they can question things, they can ask their parents about the harms or the consequences or the feelings or whatever it might be that they have. And then from there, we're using some of those tips that I had mentioned in my presentation.
Okay, great. I'm going to go back to Daniel. This is a little bit more specific, and feel free to just say, no, I don't have the answer, but I've had a few questions like this. It's sort of in the realm of, is the technique that you're talking about really broadly applicable, or are there times when it doesn't work? For instance, this specific question is, what are some resources for working with youth that have, a cognitive impairment or maybe fetal alcohol syndrome or FASD? Would this approach work?
Well, there are going to be some limitations when working with cognitively impaired or FASD youth, and that is across the board. That's not just for addictions work. That's for education. That's for mental health. That's for employment. That's for everything. So I've seen some success with specifically FASD youth using more of a relational, more of a role-playing approach to how they're going to approach their use or their attempts to quit or cut back. But there are some significant challenges there. And AFM has a program in conjunction with the Department of Justice called Operation Starfish, where they're working one-on-one with young people who are diagnosed with FASD and also involved in the justice system. And the program is unfortunately only funded to accept a small amount of young people, but it's having pretty good returns and has a retention rate or an amount of youth returning to the program, week after week, that is truly inspiring. So there are some programs that can be done and have been done that work around with that. But as many of you know, working with young people with FASD, I think, and I don't quote me on this, but I think the number of young people with FASD who need long-term support is quite high, like close to 80%. And I would expect that the long-term support would include substance support, addictions counseling, or working with a community agency like AFM. It's definitely challenging, and I've worked with a lot of young people with FASD or cognitive impairment, and we do have to adjust our approaches, and the number of approaches we've tried is probably equal to the number of youth we've worked with those issues.
Yeah, so it always has to be individualized, I guess, is key.
Mm-hmm.
I'm going to go back to Anna. This is about the low-risk cannabis use that you mentioned. So are there any plans for developing low-risk cannabis guidelines? And if so, what would that look like?
So some time ago, CAMH actually did develop some low-risk guidelines for cannabis use, but that was some time ago, so they're now going to be updating them based on the new literature and kind of the more we've learned in the past few years, especially in time for legalization. This is something that the task force has recommended. So basically they're going to be probably very similar to what we've seen with alcohol. So we know that with alcohol, depending on your gender, 2 drinks a day, not more than 10 a week kind of thing. and also obviously not drinking when you're pregnant, and delaying use if possible. So that's going to be very similar with the cannabis guidelines. So we're all very much looking forward to having those come out, and I think they'll be a really useful addition to the harm reduction strategy.
Great, thank you. I'll go back to Daniel. This one is, I think, about sort of the relationship, the importance of the relationship between clinician and youth. So why is it so important to ask permission before raising the subject of cannabis or substance use with a youth?
The reason why it's so important to ask permission is because young people are so often in a position where they don't have a choice. They don't have a choice about where they go, what they do. They are told to go to school. They're told by their parents to go to bed. They're told by people to do homework. They have very little control, and yet we're expecting them to grow up into functioning adults. Functioning adults who have control over their own world and who have influence over society and over their families. And when I'm talking to groups of young people, I often point out how strange it is that when they cross the stage at graduation, they become an adult. And at the end of the stage, they can vote, they can run for office, they can drink and smoke, and they can own their own business and go to university. But the previous side of the stage, they had to raise their hand to go to the bathroom. So it's a vast amount of changes that are going through, and every little bit of control we can give them, every little bit of input into the process it's going to be currency for us. It's going to be currency for the relationship. It's going to buy us a bit more time, a bit more respect, a bit more interest in listening to us. When I've had young people in my office and I talk to them about their use, and I listen to them for a while, and I say, hey, can I share something with you? Can I just reflect this a bit about your behavior? Can I just give you some input about this? And they say no. I say, great, I won't unless you tell me that it's okay. And that has done more good for me than it would have ever done if I just bulldozed right through and given them my opinion. So we always want to encourage youth to have that self-efficacy, to have that control over their lives, because they're going to. At some point, they're going to walk out of our services. They're going to age out. They're going to walk across that stage. They're going to walk out of the building, and they're going to be gone. And the more we can encourage them to take actual responsibility for their lives, it's not just going to be great for our relationship with them, but it's going to be great for their relationship with the world.
Mm-hmm. Wow, yeah. Great answer. I'm going to go back to Anna quickly. I think we'll probably do about 2 more questions, so one more for Anna, one more for Daniel, just so that the listeners know where we're at. For you, Anna, do you think there's any risk of delivering the key messages you spoke about too early in the youth development? So you talked about the importance of doing it, in grade school, but is there a risk of doing it too early that it doesn't resonate?
I think it goes back to the importance of reiterating it and reintroducing these messages throughout time. So yes, you do run a risk if you were to only speak to them about it early, grade 5 or whatever it might be, and if you don't bring it up again, then that is going to be an issue because that consistency isn't there. So it's more the importance of introducing these concepts earlier in time and then altering the discussion, altering the changes as youth age to better suit their maturity levels and their experiences, and continuing the conversation through into adulthood, essentially.
Thank you. I'm going to make this the last one. It's for Daniel, and I think it's fitting in terms of how much we've heard about the importance of relationships and privileging that in your work with youth. So what do you do, or what can you do if a youth is combative towards change talk?
Mm-hmm. Thank you for asking, Sally. It's important to remember that during a motivational interviewing approach, the motivation for change is supposed to come from the youth. The motivation for change is not supposed to come from us. So if we feel someone pushing back against us, that's a good indication that it's time to back off a little bit and try a different approach. And not only should we back off a little bit and try a different approach, but we should identify that it's their choice that we do that. We should identify that they have control and input into the conversation, and we should praise them for having their opinions and for sharing those opinions with us so honestly, and thank them for the permission that they've given us to talk to them as much as they have. when we meet combativeness with combativeness, we just get into an argument. We just start a fight. And that's never going to, there's never in the history of counseling has actually done any good to anybody to get into an argument with your client and to try to force them to do what you want. It's just going to destroy the relationship. But when they start with being combative and we respond with understanding and even support, that tends to take the wind out of their sails. And the most successful counseling relationships I've ever had with young people have been ones who walked into the room with all guns blazing, ready for blood, and months later, we were at a place where they were seeking me out actively and ready to talk on a weekly basis. And the change talk could only happen because the relationship was there.
Well, thank you, first of all, to Anna and Daniel for being here with us today and sharing both of your expertise. We hugely appreciate it. I also want to thank the audience for attending today. Again, I apologize if we weren't able to get your question just due to time. Housekeeping-wise, as just a quick reminder, the PowerPoint and recording will be posted on CSW's website shortly. You just head to our website and go to the continuing education link, and it's posted on there. As well, for those of you who attended 45 minutes of this presentation, confirmation of attendance can be downloaded by clicking the yellow icon. It's the rightmost icon at the bottom of the presentation window that you're watching now, and that'll be available a few hours after the conclusion of this presentation. You can just download that by logging back in using the link that you're using now. So thank you in advance, too, for taking a few minutes at the end to complete the short survey. That's going to help inform future CSW continuing education opportunities. So until the next webinar, thank you all again, and have a great National Social Work Month.